First of all, we need to know when you see a cue card. Cue card means the card that is given for you to speak. You need to first of all evaluate known versus unknown. Yes, you understand known versus unknown. You need to know whether the patient is known or unknown. So, see, there are circumstances, for example, if the patient is admitted in the ward, right? If the patient is admitted in the ward, you can consider that as known, right? If the patient is coming to the outpatient setting for the first time, and you can consider that as unknown, right? So your intro, the way you talk to the patient changes depending on this. So what is actually expected is that let's imagine the patient is admitted in in the hospital in the ward. You kind of know the patient, so you can say instead of saying hello, how may I help you? Instead of saying how may I address you? Can you tell me your name? Instead of that, you can say, for my record, can I reconfirm your name? That is going to be better. Or even better, you can just use any name. Hello, John. How are you doing? You look better today. How are you feeling after the surgery? For example, if somebody underwent surgery. Oh, how are you feeling today? Something like that. It would be better and more pleasant. That, I mean, you have to show your friendlier side when you're talking to the patient. You get it. So that gives you extra points. That also makes the patient trust you. I mean, it gives positive vibes. So remember, you evaluate like this. Remember, there were cue cards where a patient is presenting for the first time with the daughter's broken arm, and the patient is presenting for the admission in the hospital. In that circumstances, yes, you can say hello. What is your name? How may I help you? What brings you here? What's bothering you? Can I confirm your name, please? What is your name? Blah, blah. You can write like that. No, sorry, you can speak like that. But normally, if the patient is admitted in a ward, I mean, you can also do that technically, but it's not needed. You better premeditate a name. Just guess a name. What happens at the exam? Let's say the interlocutor's name is um, Deepak Srestha. You can talk during the warm up and make sure that you call him something. You say, can I call you Mr. Shrestha during the conversation? So you can directly start the conversation by saying, hello, Mr. Shrestha. How are you doing today? Is there anything that I might help you with? Or if you are delivering breakfast or something, you can say, hello, Mr. Shrestha. Here, I've brought you breakfast. How are you doing? Are you feeling any better? Is there any difficulty that you have or something like that? You can talk to me, something. You can always start like that. Known versus unknown. Remember, it works like this. So if it's unknown, then go in a traditional style. Like, I mean, the classic where, oh, hello, I'm one of the nurses. My name is this. I'll be your attending nurse for today. How may I help you? What bothers you? What is bothering you? How can I give you assistance or something like that? The intro changes depending on the patient, right? Now, another important aspect that we need to talk about is sympathy, empathy. We should always give a sympathy and empathy to the patient. The patient is always going to complain in a hospital setting. In a hospital, nobody's ever happy. If they're healing, if they're getting better, of course, the patient is going to be happy. But normally, when you ask a question to the patient, they're always in problem, right? I mean, they will never say something pleasant. They'll say, "Oh, I have a pain here. I have a headache here. Oh, my leg hurts, my head hurts, my stomach hurts, I'm having this difficulty, that difficulty." The patient is always going to verbalize some sort of difficulty. So your job is to give empathy and sympathy. So the first statement that comes out of your mouth when the patient expresses his or her difficulty with coping, with disease condition, with anything, The first statement that should come out of your mouth should always be sympathy and empathy. Now, there are two things here again you need to know, you need to remember precision. Precision means exact empathy. I call it like this. And what is general empathy? Of course, I encourage you girls to use exact empathy. General empathy means simply like, I can understand your concern. I can understand your concern. I can understand your concern. Oh, I feel sorry. Sorry to hear that. Oh, I'm sorry to hear that. I'm sorry. 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 This is general empathy. It works. Remember, all the examinees appearing worldwide, they're going to use this general empathy that fits with every OET situation. But exact empathy would be like somebody has a broken arm, for example. So I can understand how hard it must be for you to cope with broken arm. It must be very difficult to do your thing, isn't it? That is going to be exact. Like if a parent has come to you with the child's broken arm, you can say, well, I understand how difficult it must be for you as a parent to see your daughter or to your son or to see a child in this situation. This is called exact empathy, right? So somebody has a headache, and you know that the patient is um, an accountant, or the patient verbalizes that he or she is having difficulty coping with work. You can say, "Oh, I feel so sorry to hear that. It must be so hard on you, especially being an accountant, working so hard, and having a headache, regular headache, a constant headache." That is going to be exact empathy. So, I mean, I, of course, encourage you to choose exact empathy instead of the general empathy, but at least have it. Include this in your speaking. If you do not, you're not going to score. Yeah. There are a few tips, and I can give you here. You can all start noting down the general ones and popular ones. Mm, I'm really sorry to hear that. I can understand your concern. I can sorry here. Understand is missing. I can understand your concern. It must be stressful for you. Wait, it must be stressful for you. But can I ask you a few questions? Yeah, I appreciate your concern. Your concern is fear, worries, something like that. Remember that you should talk like this. You must talk like this when you begin a conversation, when you talk to the patient. Don't ever proceed further without giving this kind of statement. Or even if you have to ask a few questions, let's say related to diet, or you need to ask a few questions about the patient's any history or maybe lifestyle, first of all, give this statement. And then after that, you can say, uh, let's see, would you mind answering my questions regarding this situation? Right? something like that. May I ask you a few questions before we proceed further? Or something? Yeah. May I ask you a few questions before we further? Something like that. Remember. Okay. So from now on, just promise yourself that you're going to do this. You're going to add it anyhow. So once you start the conversation, once you've already introduced who you are and you've asked what is bothering the patient, you're addressing the needs of the patient. After giving a proper empathy, either it's exact or it's general, then you go with the questions. I mean, include everything that I've told you so far. All right. I'm going to erase this. Have you noted down already, girls? If there is something that you're not understanding, please feel free to talk to me directly. Should I erase? Okay. Now, clarifying things, being objective, like this. What about appetite? Are you eating well? Yeah. General questions that, clears your doubts. Do you have any pain? Any pain? Have you had any symptoms? Symptoms? Can you describe, or could you describe? Could you describe the pain? Does it occur all the time? Yeah, right? On the scale of 0 to 10, how would you rate the pain? Whenever pain comes, it's always better to include all these statements. Yeah. Is there anything that makes your pain worse or relieve it? Something like that. Clarification. I also want to tell you something that it is always important to form open ended questions and close ended questions. It's always important. Meaning, let's talk about it. What do I mean by that? Versus open-ended questions would be like, let's, for example, what is your name? The answer is going to be a statement. Oh, my name is blah blah. Closed-ended question means, do you understand me? The patient is going to say yes. Do you understand me? The patient says no. Are you getting me? Yes, no, yes, no. They are called closed-ended question. Open-ended question means you're inquiring something from the patient. So it is very important that you include this kind of questions in a conversation to involve the patient. Most of the time, what I hear is it's a monologue. You guys just talk to yourself, it seems. So instead of just you talking, it is very important that you also include the patient into the conversation by asking, making, by creating open-ended and closed-ended question. Are you following me? Are you getting me? Are we clear? Do you understand? This is going to check for the clarity, right? So here, is there anything that makes your pain worse or relieve? Then, of course, the patient is going to give a statement that's going to be an open-ended question. If the patient says, no, I don't have anything, of course, it's going to be a closed-ended question. Closed-ended means the conversation is not going to be not going to go forward after that. Yeah, remember this. Uh, so it should be a balance of many questions also that you ask. I mean, instead of just giving a statement like, I would like you to drink plenty of water, include, high fiber diet, and blah, 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 blah. When you say that, that's a general statement. But what I suggest you girls is to instead say, are there a few suggestions I would like to make regarding your situation? Do you want to hear me out? Would you like to hear them? And when the patient says yes, and then you go forward. So what I have done here is I have converted the statement into question. So instead of just me talking, I'm actually involving the patient. You understand what I mean? So instead of saying that, oh, I want you to, considering your situation, I would like you to include high fiber diet, a little bit of exercise post discharge, um, take pain medication on time, or giving suggestions. Instead of just giving such statement, first of all, create a scenario where you purposefully make those questions look. So would you like to hear my suggestions regarding your situation, regarding your condition, or regarding your disease condition? When the patient says yes, that means you've involved the patient into the conversation. Then say, I would like you to include high fiber food, such as, blah, 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 leafy vegetables and eggs and something like that into your diet. This way, you're going to score more compared to giving statements. So it should not be a monologue. Make it a keep it as a dialogue, open-ended questions versus closed-ended questions. Many, many questions to get clarification over the patient's situation. Remember, all right? Let's see. You can ask many questions like, cite which part of your body is affected, which part of your body hurts. Could you tell me more about the pain? Does it hurt all the time, or is there a specific part of the day when it hurts? When did it start? How long has it been? How long have you been suffering from headache? How long have you been feeling like that? Yes. Since when do you have nausea and all these things? You need to speak like this, right? So it's very important that you talk in details instead of just talking in broad statement. Yeah. Now another part is a little bit of history as well. After you've asked everything, to clarify and to move forward from one section to another section. So what we need to do is end of history taking. That's going to be is like this. Sorry, is there anything else that is bothering you? The patient says no, and then you move forward. And then you give your conclusion. So, your speaking has to be parts, parts, parts. So, in the beginning, it's going to be hi, hello. That means you're going to introduce who you are, and then you're going to either treat the patient in a known direction or in an unknown direction. Then you're going to ask what is bothering the patient. Then you clarify the situation, give appropriate empathy, and then you think that, okay, I've kind of asked everything. Then you end it by asking, is there anything else that is bothering you? Is there anything that I have not asked that you need to tell me? Yeah. And then if the patient says no, then you move forward. With what? Give diagnosis, your evaluation, right? I mean, in a given situation as a healthcare professional, there will be your verdict, isn't it? So you can say, I after listening to you, it seems that you're in a lot of pain. I would talk to the doctor and we can immediately begin painkiller, or we can immediately begin treatment. We can start with some diagnostics or something like that. So you can talk like this. Well, very casual, uh, very easily. I mean, passing OET speaking examination doesn't mean that you have to use some litrical or Shakespearean English. It should be simple, basically. That's what is expected of you, like a normal conversation. Well, based on your symptoms and after conversing with you, or after having after having a conversation with you, I think, I believe, I reckon you have blah, blah, blah. Well, like gastritis, you have gastritis. Let me explain. Or you are suffering from a condition known as blah blah blah. Have you ever heard of it? Always ask this to the patient. Have you ever heard? Have you ever like so by talking to you, I come to the conclusion that you have gastritis. Have you heard of this? Do you know what this condition is? And the patient either would say yes or no. If the patient says yes, you can say, well, I'm glad you know about this situation. I'm glad that you know about this disease condition. Let me explain you further. Or do I need to explain you further? Or something like that. And the patient says no. You can say, well, I'm sorry for the medical jargon. I'm sorry for the medical word that I've used. It simply means some problems with your stomach. Anything that has itis means inflammation or it's inflamed or something like that. So simplifying that. Yeah. Or if there's an X-ray involved, the X-ray indicates this, blah, 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 that you have a fracture. The test shows that your cholesterol is elevated. It's probably related to your diet. It's probably related to your lifestyle. Let me explain you. Would you want to hear me out? Do you want to hear me further? Can I give you more explanation? Something like that. Take permission and move forward again. Right? Then you can talk, it is a condition that's caused by this, caused by that. Or you can say, when you ask a question, so cholesterol, your cholesterol is very high. So can I ask you a few questions for clarification? Or you can say, by looking at your case note, by looking at your progress note, I've come to know that your height and weight is not in right proportion. You're slightly obese. You're slightly overweight. Maybe that is the contributing factor for elevated cholesterol. So what we need to do now is to change our lifestyle, include exercise, good food, so that the condition can be reversed. Maybe we would need another follow-up test after a few months to see your progress, something like that. So in your situation, the best like this, in your situation, the best treatment would be, yeah, blah blah blah, lifestyle modification or even medication, you can say. You get the point, right? Now, management part. Have you copied this? I'm just giving you ideas. So you should think carefully, like, as per your understanding, what can you do and what you cannot do. This is just my idea, but you can modify that as per your needs. You can, of course, improvise. It is completely up to you. right? After this, let's see. I think for management, I think we should start with you have to doctor's prescription. I will write a referral letter. I would like you to see a, you can give a name, an ENT or a gastroenterologist or cardiologist, or basically what I mean is specialist, like you to see blah blah blah. Right? Yeah, we will run some more tests to further confirm. Do you think we can do it? Or something like that. Management, you can also do like that, like first of all, considering your situation, considering your situation. First of all, it is important to blah blah blah. Do you think you can do it? Will you be able to do it? Will or would do it? How do you feel about it? Yeah, there are many or some strategies to cope with blah blah blah. I would like to. I would like to explain them for you. Is that okay? Yeah, something like that. Where it must be difficult, difficult question for you. But the good news is that their option available that will surely help you. Would you like to hear more about it? Always create questions towards the end. Would you like to know more about it? Something like that. Or about it, about that. Yeah. You should talk in such a way that the patient depends on you. The patient feels very well. The patient trusts you. The patient confides in you. It's very important to use such language that the patient believes you. You can even introduce sentences or statements such as, our hospital has excellent medical professionals. We will do everything in our powers to help you. I've been working in the department for 15 years. I've been working in this field for 15 years. I am sure you're going to feel better. if you follow our advice. It is good time to start whatever we are telling you. I have seen many patients in my clinical practice recovering fully. So I don't see any reason why you would not feel better. I don't see any reason why you would not recover. So please trust us. Please trust in me. You are going to feel better. Yeah, please remain positive. Please remain optimistic. I am sure you're going to beat this condition. Yeah? You can also talk things like reassurance. This is a common condition. Yeah, there's nothing to be alarmed about. To be or to get, uh, we will handle it together. Yeah, we will make a plan. We can do it together. Are you with me? Something like that. Don't worry. If you can follow my advice, you'll get better very soon. It'll go away by itself in a few days with some rest. It will go away. Your situation is going to get better if you modify your eating habit. So the way I have questioned you, the way you have given me the history, your diet seems to be a problem, or your medication incompliance seems to be a problem. So if you fix that, if you listen to my advices, it will be fine in a few days. Something like that. It'll get better with time. So that reassurance is needed. The staff here are very experienced and will take very good care of you, and anything that builds confidence, that the patient feels good. You have to always use this kind of um, dialogues, include this kind of sentence into your conversation, right? And basically in the end, always section. Do you have any questions? You should keep checking for clarity. Do you have any questions? Hmm? Okay. No, then okay, all right. I hope you follow my advices. You're going to get better very soon, or something like that. You should talk. Also, in the end, you can say if follow up is needed, I would like to see you in 1 week time. I'm going to arrange a home visit if home visit is given, so that we can track your progress, something like that. If the patient is reluctant, you can say, I can understand your concern. I appreciate your concern. I know you're in a difficult situation, but if you do this, if you do that, you're going to be fine. This therapy is necessary for you, right? If you change your lifestyle, if you modify your lifestyle, if you take medications on time, if you do what we were telling you, you're going to feel better in no time. Will you be able to do that for me? Are you clear? Something like that. You should keep talking. I understand your reluctance. I know it's a difficult situation for you, but as a medical professional, as a health professional, as a nurse, as a doctor, as a practicing doctor, as a practicing nurse, I would suggest you that you follow my advice so that you feel better in no time. I ensure you that the problem that you're facing now will go away if you follow my advice, something like that. Are you clear? Are you understanding me? Do you understand me? Do you get me? This is the way you talk. This is the way you practice. Remember. So, what I actually want is that it should not be a monologue. It should be a dialogue. The conversation should be both ways, always. And you see that by the way, the speaking lasts for 5 minutes. We are quite clear about this, isn't it? So there might be circumstances where you finish early, slightly early. or slightly earlier, maybe 4 minutes, 50 seconds, or 4 minutes, 30 seconds. Do not stop. Try to conclude, try to give reassurance. I see that you fractured your arm. It's a difficult situation. I understand. We are going to apply plaster cast and sling for this period. And usually, as per my experience, in 4 to 6 weeks, patients already feel better, and the cost is removed for anything you can say. In a period of 3 weeks or 2 weeks, the medication already shows good effect. You're going to feel better. So please be reassured. Please do not panic. Please do not be apprehensive. Please do not be anxious. You're definitely going to feel better. If you have any questions regarding your condition, you can always contact us. You can always contact me. You can find me at the reception, at the nursing station, anything. You can make a story. You can call us, right? I will give you some brochure leaflets to get more information. These days, it's very important to be informed about this situation. So you can even read about it on internet to cope up with your situation even better. You have to give this kind of suggestions towards the end. Kill the time. And actually, it's relevant. The patient is talking to you, making the patient feel very good, right? Professional. The language should be professional. When you talk, you should not talk as if you're scared. You should talk with confidence. You should sound like nurses. You should sound like doctors. You should sound like health professional. I mean, you should have complete authority over the situation, complete authority over the conversation, the power, the confidence with which you speak to the patient. Don't say, "Oh, we are going to start you with paracetamol. Do you want that? Can you do that for something like that?" You don't say that when you're enforcing an idea. You can say, as per my understanding, taking paracetamol for now is very important. So would you be able to take it for me? That is the way to go. So you have to show confidence when you talk to the patient. You should sound like nurses. You should sound like doctors. You should sound like a health professional when you talk. So the moment your statements, the moment your sentences don't sound confident, then you start losing points. So you should sound as professional as possible. The words and the sentences that you choose should be very well framed and confident. There are many things that you can learn actually with practice. Obviously, it's going to come, but you should be, open to improvement by including a lot of things into the conversation. So, you should think, okay, today we learned about this cue card. So at home, I'm going to practice this with your classmates here or with somebody, your friend or even family members. You have to practice it multiple times so that you incorporate all those statements and sentences that I told you that make you that makes you sound more professional. You get that? Do you guys have any questions? Any questions so far? So think of the cue card in such a way where you can add a lot of things on your own to reassure the patient, to make the patient feel good. All right.